Hey everybody, it's Katie. I wanted to do a little follow-up just really quickly to my video on the febrile seizure that Alice had recently. If you don't know what I'm talking about, I will link to that video and I will link this one to the original one. The overwhelming majority of comments I got were from people who had never heard of it, which is exactly why I made the video and wanted to share our experience. There were a couple of questions I just want to address like more publicly rather than just answering that individual that asked them. The first thing was like, what do you do during a seizure? Generally, like the recommendations for anybody, child or adult, when they're having a seizure. I've actually seen a lot of seizures in my life because I worked as a certified nursing assistant in a hospital. I also worked in a very large soup kitchen that served a lot of people who had seizure disorders and would frequently have seizures there, and we would attend to them and then call paramedics. So what you do if your child is having a seizure, if anyone's having a seizure, is basically you just try to keep them safe. If they are standing and they start to fall, you catch them and lower them to the ground. It's better for someone to be on the ground than on up on a bed, or trying to hold them, or being in a chair or something like that. Just try to get them to the lowest safe place. You don't restrain them in any way. They're going to be like jerking around and everything. Don't try to hold them down, or keep their limbs from like shaking so much. Don't try to put anything in their mouths. There's like this thing, I think it's like in the movies, like you're supposed to put something so they don't bite their tongue. If that's going to happen, it probably already has by the time the seizure starts. So you're not going to try to force anything into their mouth. If they start vomiting or showing signs of like, turning blue, something where they're not getting enough air, you want to try to protect their airway. If you can, turn them on their side. If they're like vomiting, that way the vomit can like come out rather than make them choke. And of course, then you just want to get help as fast as possible. Okay, so that's general first aid for seizures. Another point was about alternating Tylenol, or acetaminophen and ibuprofen, so like Tylenol and Advil or Motrin. And I agree, both our pediatrician, who we really love, he's a super smart guy and has over 30 years of experience. He said this, and also the doctors in the emergency room. We only had Tylenol at home at the time, so using Tylenol was better than nothing to try to lower the fever. But yes, the doctors said that ibuprofen, which is Motrin or Advil, is actually better with viruses. Of course, when your child starts getting sick, you're not really sure if it's bacteria or virus or whatever. But by the time we were in the ER and she had been checked out, they had a pretty good idea that her illness was following the pattern of a virus and that she was responding better to the ibuprofen, so they could say that, it's probably a virus, so ibuprofen is probably going to be more effective. So you give a dose of Tylenol, and then when that dose is done, it's like 4 hours later, you give a dose of ibuprofen, which is a 6-hour dose, like that. And you can go back and forth, and they sort of work more effectively, the research shows, than just doing one. Like I said, in our situation, we only had Tylenol in the house at the moment. The last thing is, when I talked about not medicating a low fever, I don't want to give the impression that I don't believe in treating your child when they're sick or anything like that. The reason I generally don't give anything until a fever is a little bit higher, both in myself and in my kids. This is something that's, again, supported by my pediatrician. He's a total like middle of the road. He's not like a really fringe doctor or anything. This is also an evidence-based practice. It was actually something that was in place in the hospital that I worked in 7 years ago in Alaska, the largest hospital in the state. It's the first place I even heard about this practice, and since then I've just been hearing more and more about it as like the evidence continues to support it. Low fevers are effective at fighting infections in the body. That's your body's natural response to fighting off bacteria. Some bacteria can't live at higher temperatures, so that's the function of a fever. However, when it starts getting into a higher range, you can have, complications and stuff. So in this particular situation, our doctor said that the type of virus Alice had was the type where it comes on super fast, and this fever just spikes super high. It's highest right in the beginning, and then it generally tapers off, which is exactly what happened with her. She didn't have any fever at all by the 3rd day. And there's really nothing we could have done differently. Giving her Tylenol a little bit earlier would not probably have stopped that progression of that illness in her body. That's just the way her body responded to this particular virus. Febrile seizures are fairly common, like I said. They happen in about 4% of children under the age of 5, I think it is. Most common around age 2. Most common with fevers that spike at around 104 degrees. sort of textbook in this case. I don't want to imply that we didn't follow some sort of treatment that we could have followed or anything like that. To be frank, I actually disapprove of when people, I feel like, take risks with their child's health. You know, we've had a child in the NICU. We don't screw around, basically. When it comes to our kids, we do what we need to do to get them healthy. So that's it. You can probably hear August waking up. I just wanted to answer some of those questions, try to give a little bit more information, what little I know. Again, I'm not giving medical advice. I just want to give a little bit more backstory and some of the things I've learned through this experience. So that's it, guys. Thanks for watching.